Back now on Triad today, we always like to get this lady here with us whenever we can grab her from her duties, which are many and numerous that she does for the community. Lori Bates, her director. Let's meet our good friend Sheila Jones, Director of Marketing for Mountain Valley Hospice and Palliative Care. Thanks you for being here again.
Thanks for allowing me to come.
Very quickly, for anybody who maybe has not seen one of our segments, give me a 10-second or 15-second thing on what is hospice and who it serves.
Hospice is serving folks with terminal illness with a prognosis of 6 months or less, meaning that if whatever they have, no matter what it is, takes its normal course, and the physician deems that being a normal course, then we can take care of them.
And I want to come back to that in just a second, but I have one other thing I want to clear up. What is the difference? Sometimes we hear this, we've seen things on TV or whatever. What is the difference between Mountain Valley, which is a nonprofit hospice, and a for-profit hospice? What's the difference?
The differences can be in some of the services that we get to provide, such as Mountain Valley. We have things like transitions and honoring veterans and the Kids Path and those different types of services that are funded fully by the community, where a nonprofit may not want to invest those dollars and be able to do that. So
and you don't turn anybody away, do you?
No, and that is the biggest difference, is that we as a nonprofit, where we get to have community dollars and folks send memorials and honorariums in memory of folks, as well as grants and things, would allow us to take care of people whether they have, no matter what insurance they have or ability to pay.
Yeah.
So we're still graced with that wonderful phrase that we can do that.
Now, speaking of helping people and not turning people away, you've started a program called Care Choices. What is that?
Well, it's not really a program. It's a model that's been handed down to us by Medicare. We've been chosen to help with a huge study with hospices across the nation. Only 141 hospices have been chosen, and what it'll help us do is help us to understand if folks have the ability to have a terminal illness, as well as still seek aggressive treatment, like maybe their chemotherapy to cure their situation or to try to cure that. Will they choose hospice sooner?
All right, let's give a specific example so that I don't get confused here. Give me an example of somebody, because normally, and my mom and dad went through this, and hospice did a great job, but normally the situation is you're end of life, you're being cared for, but the hospice folks don't actively do things other than keep you comfortable as normal.
We take care of symptoms, we manage your symptoms, not aggressively treating cure.
But under this new initiative, this study that you're working with Medicare and the trial, it's a little bit different. So give me an example of a disease or something or a treatment going on that could be a dual thing.
Say someone has stage 3 or 4 lung cancer. They can still be getting radiation or chemotherapy to possibly cure that lung cancer, but if that cure is not coming quick enough, that person may have that 6 months or less prognosis. So they have to meet that hospice criteria still, but at the same time, they can still at the same time have hospice and be trying to get that cure to figure out which way they want to go.
And that's unique.
That is very unique.
That's very unique. You don't.
And the reason they're doing that is to look to see if people will do that earlier, as well as also helping to understand how to pay the hospices for those services, to help, to encourage that, because the length of stay over the years has significantly went down for folks in hospice. People are waiting for the last few weeks of life. We want to care for them in the last months of life.
That gets into the whole palliative care thing.
Right.
It's what we did with my dad.
And so families are missing out on all the wonderful things that hospice can do, helping the children in the family prepare for what's going to happen, helping the significant other, be able to handle and take over and transition into being the leader of the house, maybe if it was her husband that was sick. These things people are not getting to take advantage of that we can offer them in services because they're waiting till the last few weeks, or maybe when someone can no longer travel or no longer get out of bed.
And then you can't do that transition. You help them transition.
We have them transition. We want them to be able to go out and visit, go to dinner, do whatever they want to do. They don't have to be homebound, where everybody has that misconception.
Yeah. What is the right time for somebody to talk with your folks about hospice for a parent or a loved one?
At any point when they feel that they can no longer handle the care, or when they're not sure where to go, we want to be those experts. Even if we as hospice can't serve them, we are connected with such a huge, vast network of other agencies and services, and we kind of become the experts of what is out there for someone of this age and this dynamic and with these problems and these dynamics. So we can help them. Even if we can't provide the services, we can help them connect the dots.
And the key, again, is not to wait too long.
Not to wait too late.
And, of course, here's the website up on the screen. You can see it, mtvalleyhospice.org, for more information about all the great things and services that are provided to families and patients. Thank you for everything you do.
Thank you.